The Canadian Dental Care Plan extends dental coverage to those who need it the most. But here's the question we're not asking enough. Does it actually cover treatments that matter the most? In this video, I'm going to show you how, for many Canadians, being approved doesn't always mean being covered. My name's Zahir. For the past year, I've worked closely with Canadians navigating complex dental cases, people who followed the CDCP process and still found themselves stuck when they needed treatment. If you've qualified, waited, and still can't afford the care you medically need, I understand the frustration. Stay with me, because I'll also explain what options exist when the system falls short. Now, to be fair, the CDCP is progress. It improves access to basics, exams, cleanings, fillings, and preventative care. And in a country that prides itself on universal healthcare, that should be the baseline. But here's the problem. The biggest issue with the CDCP isn't who qualifies, it's what gets covered. And the most expensive treatments, the ones with the biggest impact on long-term health, such as crowns, bridges, implants, and full mouth restorations, are either only partially covered or not covered at all. For many Canadians, that creates serious financial pressure. Let's make that real. A single implant in Canada costs $5,000. The average Canadian earns $60,000 a year. If someone needed just 2 implants, that's $10,000, nearly 17% of their annual income for a single medical issue. At that point, people are left with 2 choices: pay thousands out of pocket or delay care at the risk of their condition worsening over time. I know this personally because in 2018, my sister needed a dental treatment in Canada that cost $57,000. My dad took out a mortgage to pay for it. That experience forced me to confront how limited people's options really are. A few years later, I founded Dental Pathways to help Canadian patients access trusted, affordable dental care in Turkey when the local system doesn't fully cover medically necessary treatment. The CDCP is a step forward, but it doesn't cover the most expensive necessary care. And when essential treatment falls outside the system, people look to additional dental pathways. Exploring dental care in Turkey is one of those options, and it's something hundreds of Canadians are already doing every year. If you're wondering whether dental treatment in Turkey is safe, I break that down in my next video.